semester, we're going to be able to come up with a definition for postpartum justice. So as it turned out, when you hashtag postpartum justice, nothing comes up, and you Google postpartum justice, also nothing comes up. We are very, very honored and happy to have Dr. Chambers. She's an assistant professor at UCSF in Biostatistics and Epidemiology. And her work does sort of center on defining racism, how it impacts. And you'll be surprised that I think in many ways you would think is common sense that how racism can impact health across the board. But in science, unless you can measure it, they don't accept it. And that's one of the challenges. So Dr. Chambers has done a lot of work in that area, and I was very impressed. I was in one of her other presentations. I think what defined her work and being very different from a lot of other researchers' work is her connection with the grassroots, with the community. Because a lot of people who are at UCSF, they may be doing research and maybe more on the Ivy Town level or on the theoretical level. But her work is very, very much grounded in the community. So we welcome you.
Thank you. Well, thank you for having me today. I'm very excited to be back here. So I did undergraduate studies at UC Berkeley, so I'm really excited to be back and to share my work with my community. So as mentioned, I do work focused on racism, and particularly like centering in on Black women's experiences and trying to understand how we can do a better job at measuring it. So for today, if you are in the social media area, I would like you to use the following hashtags around discussions today. So what's really important and what I'm really trying to focus in on is that we should listen to Black women when we're measuring structural racism, when we're talking about their experiences. And then also please do hashtag to UCSF PTBI, who has funded some of the work that I'll be sharing with you all today. So here is a brief overview of what we will cover. So first I'll start with sharing disparities for California in the U.S. around maternal and neonatal outcomes. And then I'll move into understanding what racism is and how it impacts maternal health outcomes as well as neonatal outcomes. And then from that work, I'll move into my most recent study where I worked with Black women in Oakland and Fresno, trying to understand how they conceptualize racism in their communities, with the focus on trying to develop more novel measures of structural racism. I'll have some time for Q&A and a little group activity if we have time, so I'll make sure to stay on track. So if you're not familiar with this space, disparities persist around maternal and neonatal outcomes between Black and white women here in California. So the way that I have this outlined here from your left to right, you see that there are disparities in receiving adequate prenatal care, and the maternal mortality rate, and the percent of preterm births, and as well as infant mortality rate between Black and white women. And this is a similar story that is told when you go outside of maternal and neonatal health outcomes. So really situated within the United States, when you look at health outcomes in general, we see that there are disparate rates. But what's also interesting is here is a map of California, and this shows the preterm birth rates across California counties. So the areas that are in darker orange are areas where the percentage of preterm births for that county is higher than California. And then when we see the white areas, those are the counties where the percent of preterm births are lower than the California average. And so it causes people to start thinking like, okay, maybe there's something that's going on at the structural level that kind of impacts the way in which people receive care or their day-to-day lived experiences that contribute to poor health outcomes. And here is work done by the Preterm Birth Initiative where they center in on Fresno County, and more than 40% of all preterm births in Fresno County is clustered within one geographical unit. And that those particular zip codes also happen to be predominantly people of color and people who are of low income. So what have research scholars been doing? So we are at a place now in the literature where we know that individual level factors, they do explain some variation that we see in these outcomes. For example, smoking during pregnancy, having diabetes or hypertension. But what research consistently shows is that it does not explain all variation that we see between Black and white women. So a lot of scholars have put their direction towards the pregnancy context, particularly looking at exposures to racism across the life course and during pregnancy. So I always like to start off with a definition of racism, just so we're all on the same page. Some people think they know what it is, but don't really understand what it is and how it operates. So this is a quote by Tian Dominguez Parker, and she describes racism as a system of domination and oppression based on physical characteristics, such as skin color, and our racial group affiliation, rooted historically in ideological beliefs about the innate superiority and inferiority of certain groups, whereby one racial group, which within the U.S. context are whites, derives benefits and privileges from the systematic and pervasive subjugation of other racial groups, which in the United States happens to be Blacks and other minority groups. So this is from one of the articles that I shared with you all today by Dr. Kimora Jones, where she lays out levels of racism. So racism is a system of oppression. Just put that out there. So when we talk about racism, we're talking about a system. And in order for racism to develop and perpetuate in society, it must have these three levels. So the first is structural racism, which really focuses on institutional policies and laws that are put in place to allocate resources to advantage one racial group over another. And then this trickles down into interpersonal relationships or individual racism, which we understand as unfair treatment between two groups of people, so interactions between people where one person or a group of people treat others differently based upon their racial group or status. And then you have internalized or self, where that really focuses on the oppressed group taking on all those negative stereotypes associated with their group and just saying that I'm going to live up to these stereotypes. And one example could be in the United States in particular, there is this myth that Black people don't go on to receive higher educational levels. So someone who's internalizing racism, they say, you know what, I don't want to graduate from high school, I'm going to live up to the status quo. So how does racism show up? So this is from an article that was published by Greenlighting Institute in 2017. And on your left, this is a map from 1937, which was used by homeowner corporations who were distributing loans to buy homes. And the red spaces were marked as at-risk communities. So communities where only people of color were to live. And so on your right side is the current map of toxic hazard levels. And if you just spend some time to look at it, although redlining, which this is, was dismantled in the 1960s, we see that current day that areas where people of color were distributed, Black and other peoples of color, that we still see the aftermaths of racism. So those areas are still highly populated with people of color, and we see that in those areas that they're exposed to higher levels of pollution. And this article actually talks about West Oakland in particular, and how residents in West Oakland receive higher levels of pollution than other areas that are predominantly white within the area. And then also, if you guys have been paying attention to media lately, it's a really hot topic about racism and what we see as far as disrespectful care within the healthcare system, particularly women's birthing stories. And one most recently is Serena Williams' birthing story, which supports data that has been published that says that no matter Black women's educational attainment or increase in income, that they are also still at risk for experiencing disrespectful care as well as maternal mortality. And then here it says, why is America's Black mothers and babies are in a life or death crisis? And the answer to the disparity in death rates has everything to do with lived experiences of being a Black woman in America. So racism is something that people are starting to recognize nationally. So starting to get a lot of national attention, and people are really interested in seeing what can we do about this. So now I'm going to talk about some of my work, in particular to catch you guys up to speed on ways in which structural racism is measured, and to share some of my work around looking at indicators of structural racism and their association with birth outcomes. So traditional indicators of structural racism looks at residential. That redlining was the effect of racism, and that distributions of Black to whites within a geographic unit could give a person an indicator or an understanding of the amount of resources allocated to those groups. So for example, in predominantly Black communities, there's less access to food, less access to transportation, more likely to be an impoverished area. And so these indices really capture that. And so there's a dissimilarity index, which looks at the proportion of minorities that would have to move to another neighborhood to achieve complete integration, so having an equal number of Blacks and whites in the community. The isolation index focuses on the interaction between members of the same versus different racial groups within a given neighborhood. And centralization focuses on the degree to which minority groups are located in the city core. And then concentration looks at spatial density, and clustering looks at the likelihood that two communities of color are in a cluster. So this is how people traditionally measure structural racism in the literature. So people have been really trying to investigate new ways to measure it, because looking solely at residential segregation indices doesn't really capture the complexity of racism. So it really only looks at the distribution of Blacks to whites across communities. So new scholars have been looking at racial inequities in political participation, employment and job status, as well as educational attainment and judicial treatment. And what they do is they've created ratios of Blacks to whites at the areal unit, so like at the zip code level or census tract level, and they look at it as an aggregate to see if it impacts women's individual birth outcomes. And most recently is the index of concentration at the extremes, which looks at social polarization at the zip code or census tract level. And it really is the first measure that really looks at the interaction between race and income, which is why a lot of people are starting to move towards using this index. So moving on to my work in this space. So for my dissertation, I looked at both traditional and novel indicators of structural racism measured at the county level to see which form of either traditional or novel measures explains more variation between Black and white women in birth outcomes. So a summary of the findings. So this study confirmed that poverty is a factor when we look at disparities in birth outcomes between Black and white women. So it found that as county level poverty increased, infant birth weight decreased by about 0.5 pounds, and gestational age increased by about 2 weeks or 14 days. focusing on the traditional indicators of racism, we saw that as county dissimilarity increased, infants' birth weight decreased, and as county isolation increased, that infants' birth weight decreased. And we only saw an interaction between traditional indicators of structural racism and race, where Black women who live in counties with higher isolation birth infants about 3 days earlier than white women residing in similar counties. And although the novel indicators were novel, they didn't explain more variation between Black and white women in their infants' adverse birth outcomes. So this really showed me that, currently residential segregation indices are really, really important, and that we need to do more work to try to develop novel indicators of structural racism, because these do not explain variations in the poor adverse outcomes. I also looked at the index of concentration at the extremes, but this paper took a different approach. So from previous work, I've confirmed, other people have confirmed that racism explains more variation in the Black to white gap in adverse birth outcomes. So here I centered in on Black women and tried to understand how does structural racism impact Black women's poor health outcomes, in efforts to try to identify ways that we could develop community or policy level interventions to try to focus in and help Black women. And so, as I mentioned previously, this is one of the indices that focuses on race, income, but also the combination of race and income. And we found that Black women who lived in the least privileged quantiles had 50 to 29% increased chance of having a preterm birth compared to women who lived in the most privileged quantiles. And this is just for Black women. And when we look at infant mortality, we found that the ICE race and race plus income, that it increased a Black woman's chance by 54 to 68% of experiencing infant death compared to women who lived in more privileged quantiles. So I think that this showed me something really different than an analysis that focused in on both Black and white women. It allowed me to really look at quantiles and distributions of exposures to racism and identify what level of exposure of racism impacts Black women's poor health outcomes. So what did I learn from all of this? So although I found some significant interactions between structural racism and women's health outcomes, it still explained lower variance than I expected. So in the literature, we hypothesized that structural racism will explain more variation above and beyond the individual level indicators, and we think that if we were to change structural racism or implement policies to reduce structural racism, that women will have better health outcomes. But the data and analyses that I ran didn't necessarily support this. And so in reviewing the literature, I figured out, well, what's missing? And women's voices were not included in the development of any of these measures. So what typically happens is research scholars, we all sit together and we kind of think, okay, looking at the history of racism in this country, we think that residential segregation indices is a really good indicator of structural racism. And so we researchers sit in these rooms and they develop these things together. But I think they're missing something really unique because they don't necessarily know how women experience structural racism in their communities. And I think that maybe we're missing something. So for my postdoctoral work, I led a study that explored how Black women residing in Oakland and Fresno conceptualize structural racism and its potential impact on reproductive health outcomes, including preterm birth. And this was funded by the Preterm Birth Initiative, and I partnered with Black Infant Health. I partnered with WIC, particularly the Breast Friends group, and I partnered with Black Women Birth and Justice and the Roots of Labor Collective. Here was my study team. Intentionally, it was a team of women of color, predominantly Black women, and it included myself as well as two program directors, one who's focused in Oakland, one in Fresno. my mentor, Dr. Monica McLemore, who is really in this space and understands this work. But it was also important for me to have community researchers. So I had community researchers from Oakland, Fresno, as well as San Francisco, and we had an intern who helped us with data analysis. So we had 5 focus groups total, and we focused on the reproductive lifespan. So it was important for us to talk with women who are preconception, and we defined that as not having a live birth, women who were currently pregnant, and women who were postpartum, and we defined that as having an infant that was less than 12 months. Our inclusion criteria was really loose. You just had to self-identify as a Black woman, and you had to live in Oakland or Fresno. And so total we had 32 women. We only had 5 women who represent the preconception group, and it was only in Oakland. And it was actually very hard to identify preconception women. There are a lot of programs that you can partner with to get pregnant and postpartum women, so that was something interesting through this process. And then we had almost an even distribution across geographies for the pregnancy and postpartum groups. So what we did through this process, well, we had a total of 2 focus groups with each of the life tracks in each geography. So the first focus group focused on just talking with women to understand how they experience racism, how they see racism in their communities, and how they feel like racism impacts reproductive health outcomes. So after doing that, we used a constant comparative method, and we all initially reviewed transcripts and developed a code book collectively. At least 2 researchers independently coded each transcript. I looked at them all, and I had each person on the team look at one of the transcripts. We discussed coding discrepancies, and then we identified emerging themes and patterns and defined domains for structural racism. It was reflective of their experiences, and if not, asked them how it should be revised. We had open dialogue, as well as provided people to write things down if they were shy to talk. And then we also wanted to get their initial reaction to the domains of structural racism that emerged from their own experiences, and then to see if they had any recommendations on how to change and improve the domains of structural racism. And we did have women sign the paper to just say, I reviewed this and I agree that these domains of structural racism represent my experiences. And this was very important to us because we wanted women to feel like their voices were valued and that they were a part of the research process. So as mentioned, we had a community gathering. So the Preterm Birth Initiative has collaboratories every month. And in July, the collaboratory was focused on this work and sharing domains of structural racism to the larger community. What was so important about this is that we invited women to come to this collaboratory to see what we do with data. So what was mentioned throughout the process in trying to recruit women, Black women were saying, you know what, I'm tired of being in studies. I don't know what you do with this data. So it was really important for us to bring them along the way. So we paid for women from Fresno to come up. We invited the women from Oakland to come. We had food. It was a really good turnout. And we shared these findings with the community and had people sit down and discuss, how can we measure this differently? And this is actually the woman with the baby. She's one of the moms from the Fresno group. And you can see it was just a really good event. We had about 150 people who showed up. So moving into the data, so this is the demographic characteristics of the women who participated in the study. So the majority of them were 25 to 30, but we did have women representing different age groups across reproductive lifespan. And for income, about 78% of women make less than $2,000 a month. So the majority of women were of low income and had families to support. Women had various relationship statuses, so women reported being single, in a relationship and not living with a partner, in a relationship living with a partner, and being married. And women had different reproductive goals. The majority of women, or like 50%, wanted more children, just not now. And what was interesting around the other category as well is that women in the other category kind of fit within these things, but just weren't certain about what their reproductive goals would be past their current pregnancies. So the first part of our focus group in Time with the Women really focused on defining structural racism. And this was really important for us to do this, and was the most challenging piece of the whole entire focus group, because people really don't understand what structural racism is. People could tell you how they experience racism, which is something different. So we spent a lot of time focused on developing a definition of structural racism that we'll use throughout the whole entire focus groups to have discussions around examples of racism and how it shows up in their communities. The preconception group from Oakland defined racism as the compounded historical effect of institutions and disparities that were used to systematically oppress a group of people while advancing another group of people. The pregnant group from Fresno described structural racism as biases toward a racial group created and perpetuated by governing bodies, such as government officials and police officers, that affect certain racial groups' access to resources and adequate medical care. The pregnant group from Oakland defined structural racism as systematic laws and processes that are used to oppress a group of people and has a trickle-down effect, forming and perpetuating racist ideas and stereotypes. And the postpartum group from Fresno described structural racism as unequal distribution of resources in neighborhoods that makes it challenging for a group of people to thrive. And lastly, the postpartum group from Oakland defined structural racism as a silent opportunity killer that regulates access to resources, better education, and safe neighborhoods for a particular race. So having this sit here, and for those of you who read Kimora Jones' article, I'd like you to sit or turn to your partner and discuss these definitions of structural racism, how it compares to Kimora Jones' definition, if you would add something to it. Yeah.
That's what it says.
Okay, let's reconvene. So if I could have 3 people share like what similarities and differences did you find between these definitions of structural racism and the definition provided by Kimora Jones? One person?
I think there are a lot of people here from the community who haven't necessarily
Read
read that.
Okay, well, we'll revise this question. So, what are your initial reactions to these definitions of structural racism? And what do you like about it, and what would you add?
Okay, are we talking or are we
Yes, please.
responding?
Yes, please respond.
The first thing hi everyone, my name's Ayana Davis, also known as Mama Ayana. I'm here with Healthy Black Families. And we are extremely interested in what is happening with maternal and baby, infant births and deaths. What I'm seeing here, even these definitions are powerful and insightful. I'm especially intrigued by the phrase "a silent opportunity killer." That is that's just says so much in itself. Because one of the things we often don't put in the definitions, I don't see historical, right? How things are transferred and passed down. And I don't see it defined as extremely stressful, right? Toxically stressed. I think we missed that term, and of course this is a group of mothers. They're not maybe putting words to the thing in that way that they're experiencing. That seems like an emotional response, but it's the reality, right? It's part of, defines how we respond to structural racism, and it should be in the definition in some way that we understand that structural racism is operating as designed and is designed to impact us in these ways.
Thank you, Ayana, for sharing. Is there anyone else who would like to share their initial reactions to these definitions? If not, we will continue.
I can share. Going to the last definition that was created, I feel like it's very important that they said the word regulate, because there's a division within regulation itself where a group gets access when another group doesn't. So the group that has access kind of makes it seem like it's not as bad as it is. So I think that's very important that was noted in there, in that definition, because that's what structure does, is regulate the system itself, the flow. So yeah.
Thank you, Maurice. So Maurice and Ayana, so just to let you know, like I did say, this was so hard. Like literally 45 minutes of a 2-hour session was developing definitions of structural racism, because it's not something that we typically talk about. People are used to talking about like direct interactions or like interpersonal racism. So I'm excited to show you all what emerges when we decide to listen to Black women. So these are the domains of structural racism that emerge from Black women's experiences. And at the top, so up top, all of these domains came up for the preconception, pregnancy, and postpartum groups. And below, the police and Black families and community infrastructure only came up in the pregnancy and postpartum groups. And what was so interesting was that it takes a village kind of emerged from women's experiences. So Black women, as we're talking about exposures to racism, they identify ways in which they can combat racism within their communities. So I'm just gonna let this sit for a minute, but then also read how we defined all of those domains, and they were based upon women's experiences, and then to remind you that we went back to talk with women to make sure that these definitions met with their experiences. So we defined medical care as racial inequities in access to and engagement in adequate reproductive health care. Negative societal views as historical and contemporary negative and false representations of Black people that create and perpetuate damaging stereotypes. Law enforcement, racial inequities in the number and type of interactions with police officers. Employment, unequal employment opportunities and support, including during the pregnancy and postpartum periods for Black women and families. Housing, systematic laws and supports used to discriminate against Black individuals and families in finding adequate housing in safe and resourceful neighborhoods. Hidden resources, lack of knowledge of availability of community resources and programs addressing women's health issues. Education, educational system explicitly and implicitly designed to create and sustain racial inequities and disciplinary acts and access to resources in the school system. And then the following two, just wanted to remind you that they're only came up during the pregnancy and postpartum groups. Policing Black families, lack of laws and processes in place to support Black families and community infrastructure, racial inequities and community assets and deficits. And then what was so powerful to me was this domain that just organically emerged, it takes a village. And define that as uplifting the Black community through advocacy, solidarity, and the establishment of Black-owned businesses to increase job opportunities and community wealth. So I guess we can open dialogue. So if you could reflect back on the measures of structural racism that I talked about. So the traditional measures, which are residential segregation indices, and these novel indicators that try to start to look at Black to white ratios in educational attainment, judicial treatment, as well as job status and employment, and then the index of concentration at the extremes that kind of looks at the social polarization of both race and income within communities. So thinking of that approach, and then what emerged here when we incorporate Black women, is like, what are your initial reactions to this conceptual framework? And you can talk with the partner, and then we can share. That seems like that works best, except for Brianna and Maurice. They're so yeah, talk with your partner. Like, what were you feeling when I advanced forward to the next slide and say, this is what happens when we listen to Black women? So reflecting on the value of Black women's voices and this conceptual framework of structural racism. Interesting things to share. So this time could we have, we can still have two or three people like share what your reactions were to this and comparing it to what we saw earlier and how centering in on Black women's experiences that something like this could emerge.
My first reaction is piggybacking off of the systematic toxic stress. This is every area, every domain of existence. I just shared that this feels like just breathing is a problem. And so how does that impact and translate to a mother pregnant with a life and all of what she's going through, passing to the child and creating disparity, you know, and just overwhelmed.
Yeah.
I think of particularly the differentiation between every group and then after becoming pregnant postpartum, like the thought process that you've experienced everything and maybe you're able to help ideally your child navigate those things, and then you have these extra layers that you also have to navigate. You know, in this particular space you're already told and have a felt sense of you were never even meant to be here. And so to have that be so visceral and then to go through this whole different process and to have extra layers of intricacy on top of that, it's how difficult that is in a time of celebration and excitement, and now here's a couple of extra things to be afraid of that you never even maybe thought of, potentially.
And then just one more person, please.
I think these are perfect examples of the definitions that came in this slide. But to echo a lot of this around stress, I don't see the mental health system up there, which I think would be an revelation.
It's not there because it's non-existent.
Okay, so to share what reproductive health outcomes women felt like these domains of structural racism actually impacted. So they talked about preterm birth, cesareans, access to abortion, breastfeeding, low birth weight infants, and access to birth control, as well as infant mortality. And this is across all groups. And so now I'm gonna share select quotes for a few of the domains that our team shared at the collaboratory that we felt like were novel and new to the current discussion of structural racism and how we should measure it. So I'm first gonna start with negative societal views, and Black women across reproductive lifespan, they voiced feeling of being portrayed as undeserving of fair treatment in the American society. And so as a result, we decided to define the domain negative societal views as historical and contemporary negative and false representations of Black people that create and perpetuate damaging stereotypes. So two subdomains related to negative societal views emerged. The first was stereotyping Black people as dangerous, and the second was negative images of the Black woman. So for the first subdomain, viewing Black people as dangerous, Black women conveyed a universal feeling of always being on the defense because society has upheld negative stereotypes that have been grossly exaggerated. And so here's a quote from a pregnant woman from Oakland, and she conveyed her frustrations about constantly being followed in the store as fear of shoplifting. And she states, there's this specific beauty supply store that I go to. Every time I come in, of course, they acknowledge me. But then I notice that every time I go to each aisle, I see the lady or the guy kind of hovering, kind of like, oh, do you need anything? And I'll say no. And I'll let you know if I need help. Then they always kind of follow me throughout the store, and I can feel it. I can sense it. And it just happens often. And it's really sad that that's something I have to go through just because I'm Black or brown. Additionally, a preconception woman from Oakland expressed similar irritation as she explains her intellect is perceived by others as something to be discouraged. She expressed, I remember being in school and I wasn't a graduate student, but I think as a Black woman, when you're smart and you're ambitious and you're not afraid to tell your white peers or your non-Black peers how it is, you automatically get targeted. And this doesn't even have to be in education. This can be in any space. If you come across as a very smart Black woman, people are always, no matter what, they're gonna try to put you down. And even if you're not necessarily educated, but you have wisdom in some aspect, or you're are going to see that, and they're going to try to put it down. Also, a postpartum mother from Fresno disclosed how simply seeking to better oneself is not how she is seen by society. She expressed that negative stereotypes upheld by society are used to contain and control Black people. She states, they have us in a box. Well, they know that's what we, Black people, supposedly that we're all about just drinking liquor or beer or smoking cigarettes or stuff like that. But most people that do are raised up, properly. They grow up to be make it, do things with themselves because they don't want their kids or they don't want to have to go through the struggle that their parents went through. So yeah, that's me. I'm trying to, do better than what my parents did. So these stories are just few of millions that make up the everyday lives of Black women in America. The unacknowledged reality of humiliation and degradation are what helps sustain structural racism. So moving on to the second subdomain, which is negative views of the Black woman. Here is a postpartum woman from Fresno expressing feeling over-sexualized by making a conscious decision to breastfeed her children. She describes both her mother as well as other family members informed her that Black women compared to white women don't breastfeed.
Can I ask you something? Why is it just correlated to the white population? Why is it not correlated, for example, to the Hispanic or other?
Well, the way that racism was developed and perpetuated, so it kind of happened through enslavement, and it was...
No, I know the history, but still even
Yeah.
nowadays, why is it just compared to the white population? That's why.
I feel like that's the dominant racial group who has developed systems to perpetuate structural racism. To answer your question too, you'll see that some women from Fresno in particular, that they'll talk about experiencing racism from both white and Hispanic persons. But if you think of it, it's a scale. I don't necessarily know who wrote this paper, but there is like a scale where white people are here, black people are here, and all other racial ethnic groups are in the middle. So it is a chance that someone else would experience racism or discrimination from another racial group, but the dominant group is white people, which is why you'll see that. So she expressed, my mom came up a certain way. So she's like, black women don't breastfeed. She was like, that's something white women do. Black women don't do that. They don't use cloth diapers. They don't do any of that. And I'm like, if you can see all the groups they have, like basically Black infant health, and then like black women breastfeed, black women cloth diaper. But she's like, I don't want to hear that. That's white people. So to me, I feel like my family is kind of racist. I'm not going to say it, but it's like, I'm a black woman. I do these things. But to her and like to my other family, that's a white people thing. Yeah, like black women are not supposed to do that. But I'm a black woman, nurse, but I'm like, black women nurse the white people. Her words is, you're doing that for sexual reasons. I'm like, I'm feeding my child. And here is a preconception woman from Oakland expressing similar feelings of the double standard for black and white women when it comes to public benefits and who has the right to receive them. Growing up, she was raised, as was expressed, by her mother was white and her father was black. And so she felt like her first encounters with racism happened at home. So she said, I think my experience with racism comes from home. So my mom is white and my dad is black. I predominantly lived with my mother growing up. We were on welfare growing up. And I remember kind of battling that because the way she looks. I don't think she thought she would ever have to be on welfare, I guess. And so she associated with a certain type of person, like black women. But which is obviously a myth, right? Because the majority of people on welfare are white people. But what struck me about it is that even growing up, I realized she was separating herself. So she was entitled to benefits, but women of color weren't, or black women weren't. And then a pregnant woman from Fresno described her experience interacting with a school worker who was performing her registration for the semester. And she expressed feeling automatically stereotyped when a woman told her that she was lucky because her child's father wasn't black. And she expressed, I was registering for school and she was asking like what my schedule was going to be and stuff like that. And she was like, oh, is your baby daddy involved? And I was like, yes, why? What brought that on? She's like, oh, because you know, some people have those type of situations they're in. And I'm like, what do you mean some people? And she then kind of just tried to change the subject. So I'm like, And then she asked me like, what was his race? And I told her that he wasn't black. And she was like, oh, you're lucky. So black women, they describe negative societal views of black bodies and women as a degrading process experienced in multiple spaces across the reproductive lifespan. So moving on to examples from the housing domain, and just to refresh your memory, here's the definition. It's defined as systematic laws and supports used to discriminate against black individuals and families and finding adequate housing in safe and resourceful neighborhoods. And we had two domains that emerged here. One focused on segregation, including other forms of inadequate housing, such as forced eviction and gentrification. So we're first gonna look at codes related to neighborhood segregation, and just reflecting on like the residential segregation indices. We know that residential segregation is something that is highly documented in the literature as an accurate representation of structural racism and how it operates. So a pregnant woman from Oakland discussed how neighborhood segregation reflected a system of oppression that controls which groups of people can live in certain neighborhoods based upon their race and ethnicity. And she states, housing, in my mind, is a product of hatred based on racism. Then I control who lives in my house based on what they look like, or who I rent an apartment to based on what they look like. discrimination practices that limit where Black people can rent reflect one of the ways Black women experience racism. Here we have a woman from Fresno, which you guys aren't, if any of you aren't familiar, that's like Central California, talking about similar things. So she says Fresno is not that big. Like, we don't have a lot of Black and brown people, and it's concentrated to West Fresno. And a pregnant woman from Fresno says there's no big stores, and then gas is higher on the west side, which is a way also. And when you go to the white neighborhood, gas is cheap, really cheap. And then there's every store you can think of there. And so here they're describing residential segregation, but also what comes with that, like the allocation of resources, the lack thereof resources, and how prices are really different when you are in a predominantly Black versus white community. So in addition to the availability of resources, a preconception woman described how resources are unfairly distributed among Black neighborhoods compared to white neighborhoods. And she particularly discussed a series of meetings that she was involved in as a student out in East Oakland that was focused on allocating resources to help communities within a certain region. And she expressed organizations in predominantly white neighborhoods, to do things for their communities. And so it's weird because it seemed like the most fair thing to do, but the organizations that were located in those more affluent spaces were doing more with the money than in poor places. And it was just messed up. I'm like, I don't know what you're supposed to do. You can't, like, equality doesn't work here. You have to be equitable here. It doesn't work. They're not all gonna have the same experience if you split it up that way. So I just felt like it was wrong, and I saw it was wrong, but I had people being really upset. Like, they were heated, and they were mostly people of color that were mad. Everyone else who was in the more affluent neighborhoods, they were quiet. I was like, okay, clearly something's wrong here. So equal distribution of resources contributes to the unequal impact of those resources in poor communities. So really thinking about, like, structural racism as the system that separates groups of people and allocates those resources accordingly to advantage one group over another. And moving on to the second domain, which is focused on the adequate housing. And so women primarily talked about being evicted, and what we're all experiencing now in the Bay Area, gentrification. So a pregnant woman from Fresno described, I got a 30-day notice, and they didn't tell us why. I think they were trying to get more Mexican people. So here's an example. So we wanted to talk to them about it, like, what is the reason for the 30-day notice? And she still hasn't told us. But only the Black people in our apartments are getting evicted. Women also discussed gentrification as a process that limits the availability of affordable housing for Black people and families. So here is a postpartum woman from Fresno, and she described how the gentrification process forces Black people and families from stable housing and out of their neighborhoods. So she expressed, it's gentrification, like they're beautiful old studios, apartments, and flats and stuff. They are the gentrifiers getting wealthy. They're getting income from an impoverished area, you know what I mean? They build it up and then they sell it at like top price or rent it at where now you're pushing these people in this area out because they can't afford the rent. And that's just not something that's happening in Fresno. So a Black woman from Oakland described how gentrification limited what housing was available. She discussed her experience of discovering how white people were given financial incentives to gentrify predominantly neighborhoods of color. And this was so interesting to me. This is the first time I've ever heard a story like this. So she stated, one thing that really stood out to me was I used to drive a lot, and sometimes people talk in the back, and they don't think you can hear them. And I had passengers that were all Caucasian, and they were just going on. They're saying how they got emails telling them that they would get paid for moving into certain neighborhoods. I started bringing this up to other people later on, and they're like, oh yeah. So apparently they get paid for moving into certain neighborhoods, and since I came here, it took me a long time to even find my place. But there are so many people, especially people of color, that are struggling just to find a place, even if it's shared, if they have no privacy. But just the fact that there are some people that are getting paid to live somewhere is ridiculous. And so these stories related to housing shows that structural racism and the impact of redlining, which was stopped in the 1960s, is still impacting Black women's lives, Black families. So moving on to the medical care domain, and this was a domain that women had the most examples for, and we defined it as racial inequities in access to and engagement in adequate reproductive care. And there were two domains that emerged, one that focused on inadequate medical care and the other on patient-provider concordance. So here is a preconception woman who describes her experiences of constantly being prescribed medication and birth control, and she expressed that she felt like this was to control her reproduction. So she said, I was 16 or 15, I got on birth control. I had Medi-Cal, and they put me on Yaz, like for birth control, which is now, I don't know if anyone knows, but they don't like to give it to people anymore because it gives you blood clots and you could die. But that was the only thing that was the cheapest, that was available at the time. And like Medi-Cal is great because you can pretty much get your health care for free. So then they changed you to a different pill. And then that pill had side effects. And I became very depressed. And I was having pretty much like suicidal thoughts. And then they're like, oh, well, you need to go see a psychiatrist. So then they got me on antidepressants. And then they made me, you know, what I mean. And then they were like, oh, and I'm like, I can't sleep. Okay, here's Ambien. And I'm only 15, I'm in high school. And it was almost like they made me feel like it was me. Like it wasn't the medication that was wrong, it was me. A postpartum woman from Oakland expressed experiencing similar inadequacies. This woman described her experience with going to a doctor's appointment for severe headaches. Unfortunately, the doctor did not ask if she was breastfeeding, even though her baby was present, and the medication that was prescribed was not compatible with breastfeeding. So she described, I just recently went to the doctor last month, and I specifically went in there because I get headaches. And I've been getting them for years now at this point. I had my daughter with me, but the doctor never one time asked me, are you breastfeeding? She prescribed the medication to me without asking me, am I breastfeeding? And you know, think about certain things, like once you leave the doctor's office, like, okay, well, she prescribed me the medicine, but then you're feeding your baby, and you're like, now, she didn't ask me, do I breastfeed? Or she didn't ask me, you know, she didn't tell me, like, oh, it's fine for you to breastfeed while you're taking the medication. So I went, I waited as a matter of fact, I waited a week and a half, and then I had gotten excruciating pain in my head, and I finally went to Walgreens to go get the prescription. I had it filled out. Something was just like, nah, you need it, you don't need it, just wait. I went through the drive-thru to pick up the prescription, and I grabbed the prescription. But then I was like, well, let me speak to the pharmacist before because I'm unclear of, you know, what it is. I don't even know how to pronounce it. So I damn sure don't want to take nothing that I don't even know how to say correctly. So I asked the person there, and she Googled it for me, and no, you cannot take the medication while breastfeeding or pregnant or whatever the case may be. So a pregnant mother from Fresno shares a different experience with receiving adequate medical care. So as a Medicaid recipient, this woman described receiving fragmented care during pregnancy. She mentioned having to go to 2 separate facilities that are on different sides of the city. One where she received her regular prenatal care, and another where she had to go to get her ultrasounds. And so she said, due to her concerns about the health and development of her child, that she chose to go to the ER to get comprehensive care. So she expressed, they didn't really want to run it, referring to ultrasound, because I was told my baby was going to be too small. And the ultrasound scheduled my appointment versus my doctor, but my doctor told me to stop going to get ultrasounds and that everything was going to be okay. So I just started going to the ER to get everything taken care of. And to me, this was the most shocking thing. It really stuck with me since doing this focus group, that women decide to go to the ER to get comprehensive care. So moving on to the second domain, which is patient-provider concordance. So women expressed a need and want for Black providers as a strategy to receive adequate care. So despite this need, women shared that there are a lack of Black providers in their areas, particularly those that serve Medi-Cal patients. So this is an Oakland woman, a postpartum woman. She described, I wanted the same midwife that delivered my daughter at Highland. She was an African-American midwife. I felt super comfortable with her. So I tend to go more towards African-American physicians just because I feel like they can relate to me more. And I do feel like there's a lack of African-American physicians within our communities. A postpartum woman from Fresno also shared that there's a lack of Black providers in the area. She further described that not having providers for the Black community is stress-inducing. She said, I think if we had a doctor, like, how can I say it? A doctor that's for us, you know what I mean? That's for us, that gives us all the information that we know that what they're telling us is going to be something helpful. Like, we don't have that. Like, it's people on welfare, we have doctors that are supposed to be your doctors. You really don't see the doctor. You see a nurse practitioner and this and that. So you really don't get to, you're seeing somebody that isn't even trained to be a doctor. And they are not like, I mean, me, I take my kids to the doctor and the nurse practitioner come in and I'm like, well, you're not the doctor. Like, where is our doctor? Why is he not here today? So if we had something like that to where we had doctors for the Black community that was to help us out and see our patients and see their patients, then that's something that would not stress people out. To know that, hey, I can go to the doctor and talk to my doctor about this and that, you know, and get resources from them. There's not a lot of places that do that here. And a pregnant woman from Fresno further describes the impact of the lack of Black providers in the area. She expressed feeling uncomfortable walking to the doctor's office where she was the only Black person. She describes, like, maybe when you go outside a doctor's office, like, you know, at Willard and Herndon or whatever, and when you walk in, everyone just stares at you. You know, like, well, say hi at least, don't just stare. Say hi or something, you know? That's how my primary doctor is mostly Hispanic, and as I walk in, I'm the only Black, and I'll be like, wow, I need to find me a new doctor. So these stories and experiences reveal how Black women experience racism as they navigate health systems. And I feel like these stories describe like direct interaction with racism, but really reflects how the system has felt them and isn't made to support them to have healthy pregnancies. So hidden resources. This domain was something that was so interesting to me, and I feel like it's not in the literature anywhere. So hidden resources was described as a lack of knowledge of the availability of community resources and programs addressing women's health issues. And in particular, women talked about hidden resources in two ways. So the lack of health information that's available or hidden from them, as well as community access, which was very interesting. So the first domain was health education. So Black mothers often struggle and feel alone when trying to seek resources during pregnancy to help them learn more about their pregnancies and to have a healthy pregnancy and birth outcomes. So here is a pregnant woman from Oakland, and she expressed, I know for me, to get into the Black Infant Health Program, I didn't hear about it. And I feel like it's, I don't know, maybe it's just me. I feel like it wasn't advertised enough, even like in the hospitals. I feel like I know for a fact if it were for, I don't know, a Caucasian community, they would get a lot of resources and a lot of information in regards to maybe their baby's health or join a certain group to assist them. Or I feel like it's stronger for them to get information or whatever resources they need. I feel like it's easier for them to attain it and it's always there. But for us, or for Black people, I feel like we actually have to take an extra step and do a lot more to help ourselves. And I'm talking in regards to like infant health, taking care of our babies and so on. They don't make it easy for us. Because of that, we kind of give up and not bother. And if you guys aren't familiar with Black Infant Health, it's a statewide program. So just know that you women didn't know about it. And so a woman from Fresno shares similar sentiments around the Black Infant Health Program. She states, I didn't know about Black Infant Health. I'm gonna raise on that. I didn't even know. Like, I've been here in Fresno for almost 3 years and didn't know nothing about the Black Infant Health system. None of that. They helped me out a lot. They gave me a lot of resources. So these examples affirms women's sentiments to the broken system that they must live in and day out, where resources that are there for them to assist them with having a healthy pregnancy and baby are hidden. So here is a preconception woman reflecting on a conversation that she's had with her mom and her friends. And it's related to lack of information around interventions to avoid having a hysterectomy. So she expressed, a personal experience of mine lately that I've been noticing is my mom and other middle-aged or close to middle-aged Black women in my life. A lot of them have been getting like hysterectomies, you know, and at younger ages too. If you would expect someone to get a hysterectomy when they're older, a lot older, because of ovarian cyst or whatever the case may be. You know, they get worse as you age or whatever. But the fact that my mom and some of her friends and other people in my family were told that they should get this procedure done, and they're in their early 40s or, you know, I just feel like it seems out of place to me. And learning more about women's health now, I know that there are more options than to completely remove the uterus and prevent you from having more kids. Like, I feel like there are some other solutions, but we're just not being told about them. So, in sum, around health education, Black women often feel like they're not heard or provided adequate resources or alternative options when it comes to things as deciding not to be able to have children. So the second domain related to hidden resources was community assets. And the Black woman described community assets as systems used to purposely disenfranchise Black communities throughout California that claims to serve all citizens equally, but has disproportionately failed Black people. So here, a preconception woman from Oakland shares her experience about living in Oakland her whole entire life and not being aware of regional parks in her area. So she expressed, this weekend, me and my husband went to Redwood Regional Park. If you haven't been, it's in Oakland, up by Skyline. And I don't know if this is structural racism, but it strikes me as hidden. Because I went to Skyline High School, and I've always spent my life up there, but didn't realize if we made this one right at the right time, we go down this road. It's a beautiful Redwood Park, and I've lived here my whole life, and didn't find out about it until recently. And so, they do a fantastic job of hiding, I guess. That's another question. Hiding this free resource, and there's heck of them. So, that's one of the only ones in Oakland that I don't know. It's just like not populated. And when you walk, people are looking at you like, well, what are you doing out here? You know y'all don't spend time in nature. And so it's just funny because I'm like, this is really bizarre. You could totally, I don't know, you wouldn't look for this. Why would you look for it? So that could be another example of things that are here. That's always been here, but it's just like hiding things in plain sight. So community assets were also described as a lack of knowledge about community level resources and allocations. So postpartum women from Fresno expressed that Black communities are not typically involved in meetings to discuss distribution of resources and needs for the community. So she described, I feel like our community, its resources out there, or it's like everything is out there that people don't know enough or enough to take advantage of. So like, not too long ago, I had someone knock on our door and they were telling us about, I guess, Fresno has approved a certain amount of money and like that they're not trying to put the money into like the west side. They're trying to take the money and put it all on the north side. But we as minorities, Blacks, and you know, we don't know about that money. So we don't like push for that money and take advantage of it. Like we need this in our community. We need more things in our community for our children. And so this was a really interesting domain that emerged around stuff that's just being hidden. And it is so fascinating to me to hear women describe how they feel like resources, whether it be natural resources or resources to help build up communities, aren't made readily available to Black communities. And just to remind you, policing Black families was only something that came up for pregnant and postpartum women, so only quotes for those groups. And it was defined as a lack of laws and processes in place to support Black families. And so Black women, they particularly described being policed within government agencies, including Child Protective Services, as well as the welfare system. And so Black women discussed experiences of Child Protective Services that deterred them from receiving medical services. In particular, this pregnant woman from Oakland describes how she did not have a home birth out of fear of Child Protective Services. And she mentioned, I know there's a lot of assumptions around Black women that you're ignorant to. I don't know, just prenatal care, making your own decisions. I know there's a lot of white women who give birth at home. Me, I'd be kind of scared to do that because I feel like they would think something. But I know there's a lot of white women who don't have those kind of worries. I've actually looked it up, and then it's just like I've heard stories that people who try to do that, a home birth, and they've had CPS called on them. And I know they're more likely to call CPS on a Black woman than someone who lives in an affluent neighborhood or something. They'll say like, you're not capable of an at-home birth. Like you don't have the, I guess, education. You know what I mean? And here is a postpartum woman from Oakland who expressed similar fears of CPS removing Black children from their homes. In this instance, she expressed Black families' lack of support of counseling services, particularly in the case where a non-Black counselor talks with Black children about their home life. And she expressed a lot of our children that are in communities that go to these schools, they're not speaking to counselors or nurses because they're not the same nationality as we are. So being that, you know, their parents or us as parents, we're telling our kids, you know, certain people you don't go up to and you don't let them know the home experiences because they may try to take you away from what is your good upbringing. And you may think that grass is greener on the other side by going to Miss S, going to tell her all the business, but little do you know, behind your back, she's going to mess up what could have been your future or what could have been in the midst of you throughout your life. So yes, I do feel as though our community, or us as Black people with Child Protective Services, are being policed. And here is an example from a pregnant woman in Fresno who gave an example of her child's school calling CPS on her without a thorough investigation. And during her meeting with the principal, teacher, and school nurse about this matter, she described expressing the following. She said she told them, y'all could at least call me and ask me what happened to my son. I could have told y'all, I got a house full of boys. You're gonna always see scrapes on them. She stated that the meeting ended by her expressing to her son, you better not tell their ass shit. They wanna know something, tell them to call home, period. And women also described policing of Black families that expanded beyond Child Protective Services. So this mom describes the welfare office as an unwelcoming place for Black women and Black families. And she expressed that Black children were regulated in the welfare office. And she says everyone brings their kids. Not one child could say go there and their child sitting down. The security guard wanted to say something to the first Black kid that just get up. They'd be going to the bathroom. This the little guy just ran off. And then lastly, a pregnant woman from Oakland discussed challenges she encountered when she talked with a caseworker. She described being denied assistance for not knowing the whereabouts of her child's father. And she stated, since my son's father got off child support, they took my money down because he don't pay for child support. But then they told me I have to talk to him so they could bring my money back up. But then they told me that I should get off anyways because he's not paying and that's the only way I can get money for my son. Because they want him to be on child support. But at the same time, I don't talk to him. I don't have no communication with him, nothing. I don't know where he at. Don't care where he at, but it's since I can't get money for him because his dad got taken off of child support. So I have to find a different way to see how I can get money for my son. So women's stories related to policing of Black families reveal that racism is embedded in institutions such as social services. And that policing of Black families limits resources and experiences of home births, as well as receiving benefits that we all work for to help support families in need. And then lastly, sharing from the domain that organically emerged, it takes a village, which we defined as uplifting the Black community through advocacy, solidarity, and the establishment of Black-owned businesses to increase job opportunities and community wealth. So in the late 60s and early 70s, like if any of you are like Oakland natives, once upon a time, West Oakland used to be a thriving community full of Black-owned businesses. And a postpartum woman from Oakland, she noticed that there is a lack of Black-owned businesses in communities today. And she expressed, I think that a lot of Black people at this time start having our own businesses. I think that would help a lot, in the upbringing for, our new people that are coming into this world. A lot of Black-owned businesses. I think if we had that, I think it would help a lot more, it will help out with a lot more opportunities for people. Black women stress the importance of supporting current Black-owned businesses regularly, even if prices may seem inflated compared to our non-Black competitor-owned businesses. A postpartum Black woman from Fresno expressed, I stopped going to the Asian hair stores. Like when I want to get braids or whatever, because I know there's a Black hair store in town that I want to support. Hispanics, Asians, Italians, and etc. all support businesses of their own people. We, referring to Blacks, are the only ones that don't look at it in terms of helping us as a people. And a pregnant woman from Fresno expressed similar views around the significance of solidarity among Black people in the Black community. She says Black people need to stand up together. That's the main thing. So if we could get Black people to stand up together, just like these other people, then we'll be fine. So solidarity, particularly in the workforce, is imperative for Black women to thrive. So a preconception woman, she shared challenges she encountered trying to complete her internship hours with a private lactation consultant. She was really interested in getting experience in a private setting, but had a really unfortunate experience with a white preceptor who was providing services in this space. She mentioned experiencing several counts of racial discrimination, which caused her to seek a new preceptor who happened to be a Black woman who provided lactation services at Highland. And she enjoyed her internship experience and mentioned a silent notion between herself as well as her preceptor for an internship for Black students. And she expressed, well, having gone through my lactation program and getting my hours at Highland, I think one of the things that's going to come out of it is my mentor my mentor's name is going to go on a list, and therefore UC San Diego can pull from it and then reach out to her in a year and say, will you take an intern? But I know deep down inside it's going to be a white person. And so I'm kind of telling her, like, don't take no more people unless they're Black. Well, she knows, I think we both feel that, to kind of like, how do you get to the point where you start, profiling white people? Where it's like, I actually don't, there's enough of y'all, and there's plenty of opportunities. But if you want to precept here, only take Black and brown people. That's what I want to happen. I don't know. I mean, she gets the final say in who she takes. But in terms of solidarity, just like having this inside, notion that we only accept our own people. And Black women also express the importance of advocating for themselves, particularly in medical care settings. A pregnant woman from Oakland shares, because when you prove to them, referring to medical providers, that you know a little bit about yourself, they're not going to manipulate you, and they're going to give you their time. They will a little bit patient, but then you act ignorant about the whole thing. They'll just do everything in a rush and just let it go. So I think the more you make yourself or advocate for yourself, like when you know you're right and you know what you want, then they're going to explain to you better. So I thought that this was very powerful, that through talking about how racism shows up in their communities and examples of structural racism, that Black women also identified ways to combat structural racism in their communities. And in closing, I just wanted to acknowledge the Black women participating in this study, all of my wonderful collaborators, my community partners, mentors, colleagues who helped a lot with this, as well as my funding source, the Preterm Birth Initiative California. And I am now officially open for questions related to this project.
What brought you into looking into racism in maternal health?
It was a journey. Okay, so I was a teen mom, and I experienced, it was very challenging for me to receive care. And I feel like it was compounded. I feel like it was because I was Black, because I was young, and so I just received horrible care. So I decided I wanted to go to school. I thought I wanted to be a doctor, but fell in love with public health. And for dissertation, for thesis, I did analyses that looked at like racial disparities in birth outcomes, and found that after controlling for all these individual level factors that we know explains risk for preterm birth and low birth weight for white women, to do the same thing for Black women. And so it's like, okay, well, something else must be going on. And so I really got fascinated into like social structures, how systems of oppression kind of impacts health outcomes, and really trying to move away from a victim blaming approach and understand the systems in which women operate in. And so that really led me to look at racism and how it impacts women's experiences.
If you wouldn't mind sharing, I was curious like what your experience was, if you can isolate like an incident where you feel like racism was a factor of how your reproductive health was affected.
Me in particular?
Yeah. If you just don't mind sharing, because I think all those secondhand accounts, I'd rather hear from someone.
For me? So you don't like the women's experience?
No, I do, but I feel I want to hear like from someone directly,
How they experience. So
Yeah.
I would say that I feel like my care has been really okay, but thinking about systems, so schools are systems, hospitals are systems, and I feel like every system that I've operated in, that I have experienced either microaggressions. Something that was most recent, that's really at the front of my brain, is I'm working on a grant right now, and I was called in as an expert, a qualitative expert, who has published qualitative research studies, and then a senior white woman comes on the team to help in this space. And I was leading it before she came. I helped write up the whole section, and everything she said, everyone heard it, even though I said it a couple of weeks before, and she said it's like, oh my God, it's a great idea. I would say things, and it was like I didn't say anything at all. And so in this current grant that we put in, although I did all the work, I wasn't valued. And she actually suggested that we find a qualitative expert to be on the project, because she doesn't have any qualitative published articles. So that's how racism shows up.
How did you advocate for yourself after that?
To be honest, I didn't advocate for myself. I sat there and I was like, okay, this is happening, but knowing that I'm at an institution where it's soft money, so I need that income to be employed. So I just trying to understand like what I could do, how I could navigate, and since it's a senior person and I just started July 1st, 2018, I'm just gonna sit back and try to see how do I navigate within the system.
With you understanding structural racism, how do you support your own mental health in this institution itself?
I'm not good at that. But okay, one thing that I really enjoy about the Preterm Birth Initiative in general, so I was a postdoc with them, and now they're supporting me as a faculty member. And really have called out tackling racism as an initiative. And what was so powerful of it is that it is diverse but majority white, but required the whole entire staff, faculty to do a racial equity training. So really not putting it on like people of color or Black people to try to solve this issue, but really recognizing their own privilege as Black people within this larger institution to do the work that's needed to make sure that, you know, their Black colleague isn't carrying all the load. So I think the most important thing is to try to work on ourselves, so try to cope in the best ways that we can, because everyone copes differently, but then also to not try to carry the burden yourself, to find allies who are willing to fight and really argue and be in the fire for you. So I was really fortunate to be a part of that initiative.
I want to thank you for your work, Dr. Brittany. But for me, what comes up is nothing here is new, right?
I would argue that. So
This is what I need to hear.
yes, I would argue that. So the way that we understand and conceptualize structural racism.
We didn't hear her question.
Oh, okay. So she's basically said this was great, but nothing here is new. And so I was telling her that I would argue differently. So in the published literature, this isn't there. And if it's there, it's not called racism. And so what I'm doing, it depends on where you're at and where you work. Like if you work with women, you hear these stories, but the way that we think about structural racism and how we operationalize it do not include these domains. And so what I'm hoping that this would contribute to is publication. So now this is out there, people are expanding the way in which they view structural racism and hopefully measure structural racism, and hopefully these domains will be able to explain more of the variation that we see in the Black and white gap in birth outcomes and other reproductive health outcomes, to really inform policies or programs that we can implement to try to reduce these disparities.
So it is known that there's really no difference between disparities from very low, poor populations to well-educated, maybe even affluent Black women. You had the slide of Serena and what she went through. And so some of the supports for poor, there are supports, even though your research clearly shows that the word is not out for everything, but it seems that the supports will primarily focus on the most impoverished population. But if the disparities are the same for all, that would mean, I guess, maybe from a policy perspective, that these supports need to be for all Black women. Right. So services and all the stuff, the WIC and everything, you know, because if you're really affluent, maybe you can afford, but if you're in between, if you're not poor, but you're not affluent, there's a huge gap, which is probably a whole lot of Black women that are not able to even access because their income may be too high, so they don't meet the low poor, but they still need the services, especially in the Bay Area where $115,000 in San Francisco is low income. Like, I can't get over that. So if you're in between, you're not getting service, and there needs to be policy for all Black women.
Right. Right. I agree to that. So I feel like the statement, so the way that the study that kind of helped with that dialogue. So for white women, as they go up the socioeconomic pool, their risk for adverse birth outcomes, it goes down. And for Black women, you don't see the same thing. But if you were to center in on Black women and not compare them to white women, you do see that Black women of lower income, that they do have poorer health outcomes than Black women of higher income. And so I feel like it makes it so tricky, which is why I really hate comparing Black women to white women and just really centering in and understanding their experiences. So I think it's like two-pronged. So I think like there should be like services that's provided to all Black women, but then also it should be more services provided to those who are of low income. And another thing that came up that's really interesting, and me and my colleagues are starting to talk about, is how Black women across the social economic spectrum experience racism differently. So the way that I would experience racism in my place of work and the way that someone like of lower income would experience it would be really different. So I think that would also be interesting to try and see what type of tailored interventions are needed for Black women across the economic spectrum.
So, I know there's different branches under racism when we talk about that. What I haven't heard or seen or anyone talk about is the trauma aspect of how the racism, brings out the trauma in everyone, and predominantly female, when you have this abundance of trauma that's, trickling down to their kids, like how is it affecting their kids? And doing the post and pre pregnancy.
Okay, so for around that, it was Geronimo's came out with the weathering hypothesis. And so what we know is that Black women's bodies deteriorate earlier in adulthood due to exposures to trauma, including racism. What we're still trying to figure out, so cortisol levels for Black women, it's always high, right? So if you were, and I hate to do this, if you're comparing Black women to other racial ethnic groups, the way that cortisol reacts is like there's a down period, there's a high period, but for Black women it's consistent. So we really don't necessarily know what mechanism exposures to stress actually causes this flight response to result in an early preterm birth. But what we're doing is we have a study that's going on called the SOLAR study in Oakland, focused on Black and Latina women. I'm leading it along with a colleague, and we're collecting survey data as well as biospecimen data at 3 time points during pregnancy as well as 2 time points postpartum, so that we could really try to understand how women's bodies respond to like exposures to stress and traumas, and hopefully we're able to map it out, how stress really gets under the skin, and then come up with some interventions. So I'll have answers to that in about 3 years.
And to back up on that, what I've also heard is that the generational trauma is that piece that is like turning onto, just the population within the Black community. So just having to zoom into that piece is kind of difficult when you have all this trauma in the past from the generation coming down. So it's like, how do you handle something that's already passed down to you?
Right, so thinking of the mom as an incubator. So mom is really stressed out. Baby's first experience of stress is during pregnancy, right? So you come in stressed and already, decreasing your lifespan. Yeah.
So I was very inspired by the quotes. I'm wondering if there was follow-up with people who were in the focus groups in terms of opportunities for them to really amplify their stories, continue to be advocates in their community, because these clearly are super smart, motivated people.
So I just turned in a grant at 5 p.m. today for my department for a small grant, which is really focused on doing policy recommendations with these women. So they're really excited about coming to that collaboratory. So like they're never really invited to see what happens next. And just knowing like me being a Black woman, and the reason why I do this work isn't because like I want to be famous. I'm doing it because I really care about Black women, and I want to partner with them because I want us to have healthy pregnancies, have healthy families. And so hopefully we'll get funding. Prioritization strategy, but using that to develop policy recommendations. So really having women sit down. These are their stories, so they know the domains that emerge, and coming up with policies related to each domain that they feel they would like their particular community to move on. So I'm hoping that will happen really, really soon. And then also inviting them to working groups in the spring where we'll be kind of working with each of these domains, like as a community, try to decide what's the best indicator of structural racism for each domain that we would like to see move forward in the literature.
Hello. Thank you so much. This was amazing. I'm wondering how, or if you could describe where you put in the work of Collins from the early 2000s about preterm birth weight and low birth rate, and how they very clearly connected it to causes of racism, and how that impacted your studies.
Yeah. So from Collins' work, they really focused on interpersonal racism, so like people's direct interactions with racism. And I feel like their work rounds everyone's work around this issue. But what they've done for us is they set this foundation that interpersonal racism is really associated with adverse birth outcomes. But more recent scholars are challenging us to look at the whole system of racism. And so I am incorporating that in the study that I was talking about the Solar's work. So we're also collecting people's interpersonal experiences of racism in a hope by the time that the Solar study is done, that this work will be done and we'll be able to measure these indicators of structural racism and we'll be able to look at both together.
Okay.
Yeah.
Is it, I don't know what word I'm looking for, but is there, I feel like a lot of times in public health and research, it's like, okay, we gotta look at this one piece first, and then in 10 more years, we look at another piece, and then 10 more years, right? And so, like, yes, the issue is racism, and it's being, like, piecemeal, and I get it's, like, grant money funding, who's giving, you know, like, who's giving you the money, all of that. Is there, do you see a future, in at least your research, where you're, like, where you're trying to look at all of it? Because you're focusing on structural racism, which is the umbrella of it all. So I'm just curious.
So yeah, is that study focuses on it all. So it really focuses on people's like Black and Latina women's individual experiences of stress and traumas. And then my interest in structural racism, I was very intentional with doing this work for my postdoc and able to layer this data on top of that. So it'll be one of the first studies to look at indicators of structural racism as well as women's self-reported measures. But the unfortunate thing about research is that you have to recruit people, you have to follow them, they have to complete the study, so it's just going to be time. And I don't know why the system's like that, but it is. But it wasn't that I intentionally tried to piece it up.
I get it. Thank you.
Thank you all for the
big round.